We're already very proud of all of our residents, by the way. And now I'd like to invite the only resident of this class with a Y chromosome. Nuno, please. Nuno's going to show us how he treated a case with a more recent development in metallic brackets that supposedly allows for a faster treatment and even a more biological treatment. There have been some studies done from the department concerning this appliance, which are very enlightening as well, and I'm sure that these things will be published very soon. Dr. Strauss knows about that. Nuno? Hi. Take it away.
Thank you. Do you have the laser point? This one? That's it. Okay. Okay. Hello, everyone. Good morning or good afternoon. I would like to introduce myself. My name is Nuno Sousa Dias. I'm the only boy in this amazing group. Thank you. Thank you. Okay. It's okay like this? Okay. So first of all, I would like to dedicate this presentation to my classmates, all the PG7. As I said, I came from Portugal, but from a small city called Santo Tirso. And I would like to introduce you to my small country with a beautiful and small video. I hope it will play. Okay. Okay. Thank you. I didn't talk during this short movie because when they are singing this kind of music, fado, we should not talk. So this is the reason that I didn't explain you everything about my country. So let's talk now about orthodontics. I will present you today a case that was treated by me and under the supervision of Dr. Strauss. The patient is a male, young adult with 25 years old that was referred by his prosthodontist. His medical history is clear, and he came because he had a car accident. So he had a facial trauma 4 years ago with avulsion of the central incisor. So from the frontal evaluation of this patient, his name Sagi, we can tell some things. His face is symmetric. His nose is slightly deviated to the right side, as you can see here. From the vertical dimensions, he presents increased lower anterior facial height. So his face vertically is not in harmony. All the dimensions, they should be the same. And we can also see the midline of the face coincide with the upper dental midline, even if there is a missing tooth there. What can we say about the profile evaluation, the lateral view? Here, in this picture, we can see that his profile is slightly convex, retrognatic mandible, but at the same time, he has a strong and prominent chin. Now about his smile. We have a lot of wrong things in this smile. We can see the missing central incisor that he lost in the car accident 4 years ago. We can also see what we call the incomplete bite. These teeth, they should be like here. What else can we see? The lips are thin, especially the upper lip. And during smiling, we have exposure of the gingiva in the premolar region. That is also not in harmony with our concepts of a beautiful smile. About his intraoral condition. His oral hygiene was extremely bad. We can see some caries. We can see, probably you don't see very well in this picture, like I can see in the computer, but discoloration of the central incisor. From the lateral view, you see especially the first molars, these big teeth, okay, in very bad condition, some caries, crowded teeth, lack of space, recessions, a lot of wrong things here. So this is the occlusal view. The patient came to me like this, with first molars in this condition. We have some premolars that are blocked in. They should be in this position, making an arch form. We have some crowded in the anterior teeth. We have the missing central incisor, lack of space. Again, very bad condition, very bad oral hygiene, a lot of problems. And the patient was not motivated at all. He came the first time with a sister, and he was not motivated. So we did a models analysis like we do for each patient. We can say that this patient has a crossbite of several teeth, overjet around 7-8 millimeters, curve of SPI around 3 to 4 millimeters. The curve of SPI in the upper, you can see this is the reason for the exposure of the gingiva during smiling. What about the x-rays? Again, we see the missing tooth here, periapical pathology, root canal treatment. One very important information that we get from here is the presence of the third molars. As you know, not all the patients, they have the third molars, and you will understand why it's so important in this patient to have the third molars in the upper and in the lower jaw. We did also a cephalometric analysis, and from here we can say that he has a retrognatic mandible, and he's hyperdivergent patient. The lower incisor position, it's correct according to the basal bone, but the upper incisor, in this case, not incisors, they are slightly proclined. So, about the treatment plan. I will try now to summarize the case very quickly. So we have a patient that with a neglected dentition, very bad oral hygiene. The first molars, they were totally mutilated. We have also premolars blocked in the upper and in the lower jaw. We have missing central incisor, We have crowding. So for this, we use these digital models. We send this to the Netherlands. They gave us first the software, and we received this in a digital form. We use the space analysis to help us to make a correct diagnosis. So mainly what we decided to do, we send the patient to the dentist to extract the first molars, as you can see here, in the upper jaw, and the same in the lower jaw. Okay? What we will do is we'll bring the premolars to the arch form, the arch space, and we'll close the spaces with selected anchorage, and we'll open space for a future dental implant with a prosthetic crown. Okay, so what is the particularly of this treatment? We used a kind of brackets that are called the self-ligated brackets. These are the Damon brackets that we use in our clinic here in the university, and they have a door. Let's say we have here a slot like in a regular bracket, but we don't use the elastics. We have a special door, and the advantage of these brackets is the less friction. So the wire slides better, so we expect the movement to be faster. We expect this. So I will show you in a short animation what is this bracket, what this bracket can do. You see here is the regular standard bracket with the elastic that prevents the friction. And in this side is the Damon Q that we use to treat this case. As you see, there is less friction here. So let's start with some progress. We are taking progress records in each appointment, but I will just show you each 3 months because we have a limited time here. So the first time, after presenting the patient, the treatment option and everything, we decided to bond the upper arch. As you see, we bonded the upper arch. This is how it looks occlusally. We have a blocked-in premolar that we want to bring to this side. This is after 3 months. We are still leveling and aligning. And this is how it looks now. Just after 3 months, you can see the before and after what we could do with a nitinol wire. We could bring the premolar to the correct position. After 6 months, this is what we have in the upper. We placed now a coil spring that will create space to place the pontic. I will explain you in the next slide what is a pontic. And in the lower arch, actually after 6 months, we bonded the lower arch. And we started to do the same that we did in the upper. We started with aligning and leveling and trying to bring the premolars to the place. So here the upper arch, you can see the premolar is almost in place. We have some spaces to close, and we are using the coil spring to open a space to place a dental implant in the future. This is the lower arch. We have some crowding here. We are doing the same as we did in the upper. We are, with very simple mechanics, we are bringing the premolars to the arch. This is after 9 months. After 9 months, what we have here, we have place for a pontic. You have the coil spring there, and we continue with the leveling and alignment in the lower. So this is the occlusal view, still some spaces, and in the lower, we are able now to start to close these remaining spaces. After 1 year, this is what I mentioned before. This is a pontic. This is a false tooth that we used for aesthetic reasons, for the patient not to walk around without with a space, with a missing tooth. So when we finished the treatment, we will refer the patient to the prosthodontist to place a dental implant and to finish the treatment. So this is after 1 year. Here is the occlusal. We still have some small spaces. The lower, we still have a big space to close. After 15 months, as you see, the midlines are not, they don't coincide yet. So this is one of our goals. Okay, the space is almost closed. Now we have half space. And in this appointment, we banded the third molars that we expect to be our second molars, and this will be our first molars in the future. 18 months. No spaces in the upper. Small space in the lower. 21 months. The midline is on. We still need to improve the occlusal relationship. No spaces. Almost no spaces there. This is after 2 years. This last appointment was in November. As you can see. The patient didn't come, and I found out that he's in Thailand. He found a girlfriend in Thailand, so I don't know if I will finish this case. I hope. He left to Thailand, so I hope he will come next week. So final until November. Of course, we have a lot of things to do. We have overjet, overbite corrected. We have the midlines on. We have a more symmetric situation. So we are happy until now. Of course, it's not finished. A lot of things need to be improved, but we are happy with the results until now. Before and after, his face, the smile before and after. Okay. And occlusally, it looks much better. Again, I explain again, we extract these first molars in very bad condition, and we close the spaces to have this second molar in the position of the first, and the third in the position of the second. I would like just to mention that, I don't know if Dr. Strauss is here. He's there. So this case was already published in a French journal even before finishing. So I was very proud that Dr. Strauss did it. And now I finish my presentation, and I would like to say some words. First of all, I would like to talk about my parents. My father passed away in December. I would like to thank him and my mother for everything. They gave me the opportunity to be here. And more than this, they gave me principles. That is more important than everything else. Even if we, studying so much here, we think that life is just orthodontics, but it's not. So the principles is much more than this. I would like to thank my girlfriend that she's making a lot of effort. She's from a different country, and she's visiting me a lot of times. She understands how difficult I cannot live because the program is very tough, and I cannot fly to other countries. So she's coming more often. She has more stamps in the passport than me. So. And I would like to thank Dr. João Pimenta that came and brought my mother. That my mother, after my father passed away, she canceled the flight, and he convinced her to come. And he was also responsible for me to be here. He motivated me a lot since I was a young dental student. And I told him, I want to learn orthodontics. What should I do? I trust you. And he said, if you don't want to learn orthodontics, you go to Israel. So I said, let's go. I would like to thank some other people. I would like to thank Dr. Rafi Romano. He's not here. And Professor Nitzan Bishashu, that in a way they were like my family here in Israel. They helped me always when I had any problem. And of course to all my instructors and my colleagues, everyone. So, thank you very much.
Thank you.